All right, good Tuesday morning. Thank you so much for joining us on our Facebook Live here with WMAR2 News as well as GBMC. And this morning we are talking about what I think is a really crucial, critical topic because it impacts all of us. There's nobody that isn't touched by this issue in some way, and that is mental health. And certainly over the last year with the pandemic, this is a topic that has played out, be it if you're working from home or still working out in your job, certainly has touched all of us over the last year or so. And so I want to introduce our expert for this morning for our Facebook Live. It is Christopher Toth. He is a physician's assistant from the Jarrettsville Family Care Center out in Harford County, part of GBMC Health Partners. So Chris, thanks so much for joining us. We appreciate having you here.
Thank you, Megan. Happy to be here.
All right. So mental health, it's kind of a big topic, kind of hard to wrap your head around. I mean, obviously, we all have mental health, just like we have our physical health. So, I mean, how do we break this down into terms that people can understand, like what mental health is, the issues that come with this? I mean, you hear depression, anxiety, but, you know, for people, that might be foreign concepts to them. They don't understand. So kind of just give us a basic overview of this.
Yeah, definitely. So just like physical health, mental health is an incredibly important component to your overall wellness. Mental health encompasses, the mind, how we process things, how we manage different stressors that come into our lives. And it's really broken down into several different components. But for the most part, we think about the first tier, anxiety, depression. We've all had some element of anxiety or being nervous before something, or we've all had an element of sadness, whether it be a family loss or a particularly stressful time. And then when it starts to become these terms of generalized anxiety or major depression, they are usually things and symptoms that weigh on us on a daily basis, okay? These things start to impact our daily lives. We have difficulty going through our normal activities on a day-to-day basis. And with respect to depression, those things can come out as, sadness, a lot of fatigue, maybe even some difficulty maintaining connections, things like that. Those are just some very basic starting points.
Okay, and just a reminder, if you're watching us now, again, this is Christopher Toth. He's a physician's assistant with Jarrettsville Family Care Center. We're talking about mental health. Please, if you have any questions for him, write it in the comment box, and we'll get those to Chris, and he'll get you the answers to that. So, I guess too, Chris, kind of knowing the difference between having a bad day or sometimes you got a bad week versus something that maybe this requires a little bit more attention. How do you know if you're just in a funk versus something that might be a little more serious?
Sure. Great question. So, of course, right, we have instances that put us in short funks. When this starts to extend beyond several weeks, okay, when maybe things keep getting a little bit worse or you're just not kind of turning the corner, I invite, all people to reach out to your primary care provider, reach out to a local behavioral health clinician in the area. They are the ones, and we are the ones that actually will help make that diagnosis if that is what's going on, and help guide you. We partner with you together so that we can help navigate you through this process.
Very good. And I imagine too, when you're diagnosing something, say like depression or anxiety, this isn't like a one box fits all kind of thing, right? I mean, is this very individualized to the person and what they're experiencing, or can it be kind of a generalization? And how do you go about diagnosing that and knowing what fits that person? And then I guess down the road, what are the best treatment options for them?
Sure. So absolutely. It is not a one size fits all. To help guide us a little bit, there are some very, very basic questions that a lot of offices utilize. One for depression is called a PHQ-9. Kind of asks you to look at yourself, look at a couple different very basic questions, think kind of retrospectively when you're answering them. Then us as clinicians go over that with you. That can be a way to help us make the diagnosis, but as well as we really try and take the time and determine what is it for this individual patient, this individual person that's contributing to these symptoms. Everybody has a different background. Everybody has different stressors. Everybody has varying levels of support systems. So it's important for us to kind of tease that out in our first meeting or our subsequent meetings together, so that we can help provide the resources or the best assistance possible for the patient going through those times. Now, to answer your second question about medications and such. So again, not a one-size-fits-all situation, okay? There are many people out there, I am sure, who maybe have tried one medication that didn't work well for them and ended up changing to a different one. That is okay. That is A-okay. I want to stress that. We work together, again, partnership. We work together and make that decision, see how things are going. We offer a follow-up visit, check-ins. Counseling can be particularly helpful in those situations to provide feedback, as well as your family can provide feedback as to how things are going if we've made a medication adjustment.
Yeah, and I would imagine too, that, like you said, it kind of takes time to tease that out and find the right balance. If it is medication, if it's therapy, if it's both. Do you find that people maybe get or frustrated when maybe it's not going as quickly as they think? They think there's one magic pill that can cure all and make them feel happy and go lucky again. When in reality, it can take some time to really find that right balance for them.
Exactly. And it can be frustrating, it particularly because, likely if an appointment has been made, it's been something that's been going on for a little while. We've made the step to try and start to formulate a treatment plan. It's important to maintain an open dialogue and to really make sure that we're achieving our goals. Okay. When we have that first appointment, we set some goals. When a counselor or a behavioral health specialist meets with a patient, we set concrete goals that are attainable. Okay. We want to make things attainable out of the get-go. Everybody starts somewhere. So we make attainable goals, and sometimes it takes a little bit of time. However, patience is key. We're working together and we're forming that support structure around you.
Yeah, absolutely. And I think that's key. Support is having that support in your life, be it your doctor, like you said, your family, and your friends to help you get through this. And for anyone who's just joining us now on Facebook Live, good morning. We are talking with Christopher Toth. He is a physician's assistant with the Jarrettsville Family Care Center. We're talking about mental health. And certainly, Chris, this has been a topic I think a lot of people have been talking about just in the last year because of the pandemic. And I'm curious if you've been seeing more people coming through your practice who perhaps never had to deal with depression or feelings of anxiety before, and then the pandemic hit, and now all of a sudden, like, why am I feeling so anxious? Why am I so much more stressed than I was before? Are you seeing that in your practice?
Absolutely, Megan. This particular time, pandemic, job changes, school changes, just our whole landscape really changed tremendously. There's been an element of isolation during this time, where, albeit if you weren't able to travel, et cetera, we have absolutely seen more mental health evaluations. And that is, while that is, we realize that that's going on, I'm happy to see the more evaluations, because that means people are reaching out and we're trying to offer assistance.
Right. And that's, I think, important, is taking that first step and asking for help. And I think there is still a bit of a stigma when it comes to mental health and asking for help. And do you see that as an issue for people, that they feel like, well, that means I'm weak, or, I'm too vulnerable, and I got this, I can take care of this. It's not a big deal.
Most definitely, most definitely. Unfortunately, there is a stigma, and part of our goal whenever we meet with patients, whenever we're supporting a family member, is to encourage them. Hey, you aren't alone. Okay, a lot of people deal with these type of symptoms, anxiety, depression feelings. You are not alone. The first step is, reaching out, finding out what opportunities are there. If the reach out attempt is first to a family member, that's an opportunity for a family member or a friend to say, you know what, how can I help? Okay. Then much like with us, how can we help? Okay. There's a lot of different options for patients. And remember, everybody has to start somewhere. I kind of harp on that point, because, the first step is a positive step forward toward helping your mental health.
Yeah. And we all have it, right? Just like our physical health, we take care of our diet, we exercise. We also have to make sure that we're giving that much attention, if not more, to our mental well-being as well. That's very important.
Most definitely. Most
All
definitely.
right. And, speaking of, the pandemic and mental health, I think not even just adults who are dealing with the stress of, the isolation, helping kids with virtual learning, the fear of losing their job or perhaps losing their job, but kids have also been greatly impacted by the pandemic as well, with all these different changes. And I just saw the other day, according to the CDC, that there was a 20% increase in visits to the ER for mental health issues for kids ages 18 and under. I mean, that sounds like a pretty significant jump. That was just in the last year, within 2020. So how do parents go about starting that conversation with their teens? I know sometimes it can be difficult to pull any information out of your teenager, much less approaching them about such a serious subject as their mental health and how they're doing.
Most definitely. And yeah, those are significant numbers and significant increases that we have seen. So really, every parent to child dynamic is a little bit different. But the first thing that I would encourage and would try to achieve is to have somewhat of an open dialogue. Okay. Even us parents, is sharing, hey, I feel the stress too, or I feel the angst too, can help open the door for, your adolescent or your child to say, oh, I feel that too. And so, children often look at parents as the role models and how to handle certain stressors. So having a little bit of an open dialogue, particularly in the adolescent population, as we're matured a little bit, that can really be helpful for our teens to share how they're feeling. And then alternatively, if that is a challenge, again, having that step with their pediatrician or their primary care provider, and we can try and ask different questions in different ways and connect to see if they can offer how they are feeling. That's really the biggest goal. We want to make sure that our teens and our children are also able to say how they are feeling. I've also been so impressed with the school support that's starting to be offered, that has been in many ways revitalized during this time. And that's often a good step too for your child or your adolescent, to talk to a school counselor first to get the ball moving.
Yeah, I was just going to ask if you think it's a good idea, if maybe mom and dad aren't getting a lot of information from the kid, him or herself. Is it a good idea to maybe ask a teacher if they're noticing anything different about their child, if maybe they don't seem quite as into school as they used to be, or if there's just some changes that they're noticing day to day?
Sure, most definitely. And oftentimes with mental wellness concerns, they are often present in both environments, a professional environment or a school environment, as well as the home environment. So having that insight can be very valuable.
Very good. Yes, a lot of important things that parents should be keeping in mind, especially in we are getting back to some sense of normalcy. We are starting to see schools reopen, kids going back more often, but I suppose doesn't mean that you can just let your guard down and think, oh, okay, everything's back to normal. We don't have to worry about this. I would imagine this is something that you probably still need to be mindful of, even as we start to get closer to that pre-pandemic normalcy.
Sure, definitely.
All right. And any tips too? I mean, we talked about talking with teens, but let's say you have an adult coworker or an adult friend and you think, something's just not right with them. They've just been acting kind of off lately. How do you go about talking to, your adult peers about this? Because I can imagine sometimes that might be difficult as well. You don't want them to think that, they think something's wrong, but you're concerned. You want to bring that up. So any tips on how to start that conversation?
Yeah. So it is difficult. Again, we're trying to, break that stigma, right, of having the conversation. Open-ended questions, I feel like you haven't been yourself lately. Everything going okay? Start there, see where that takes you. You can even be a little bit more direct if that open-ended question doesn't yield you, a response. You can be a little bit more direct. I've noticed maybe you've been a little bit more stressed lately or a little bit on edge lately. Is everything okay? Is there something I can do to help you? Often you would be surprised that question can really make a difference for somebody. You may be the only person that have asked them that question, and to be able to say, you know what, I'm having a hard time with X, Y, or Z, and I'm just not sure where to go. That's where the role of a support system, a family or a friend, can really come into huge benefit here. So I would start there. I would refrain from things like, look at how good you have it. What's going on? That kind of thing we're kind of casting an assessment when we don't really know what's going on behind the scenes. So I would stick with open-ended questions like that, and also coming from the corner of support. What can I do? Is there something I can help you with?
Absolutely. And resources always a great place to start. So speaking of, what are some of the resources that GBMC has to offer for those who, might not be feeling like themselves? Maybe they think they're having some issues with their mental health and they need a place to go. What's available?
Sure. So as part of our primary care model, we've set up something called a collaborative care approach. And a collaborative care approach that we have within GBMC is we have a behavioral health specialist that works with us, that works with each individual practice. And if we identify a behavioral health need, we can often link them with a behavioral health consultant, which is one of our therapists. As well as, I like to say, we form a care triangle around the patient between the primary care provider, the behavioral health consultant, and then a supervising psychiatrist can often provide some insights if we go with a pharmacologic therapy or something like that. Additionally, we have a very, very good outpatient community psychiatry available in our affiliation with Shepherd Pratt, as well as in the respective communities. There are excellent community psychiatrists that are available, as well as excellent community behavioral health specialists, consultants, and things like that, therapists, etc.
Very good. So the resources are there. You got to take that first step and ask, hey, I need help. Where can I go? Right?
Exactly. And that can be kind of an overwhelming thing, Megan. There's so many different resources, or, hey, I go here. Where do you go? So really trying to consolidate that first step. talking to your primary care is a good place to start. We're often pretty in touch with the communities that we serve. So we've heard a lot of feedback from different patients, from different providers, colleagues, etc. And make a plan. It's very overwhelming when there's a lot of different resources, but making an individualized plan, we can help guide you. We can help guide our patients there.
Very good. And do we have a phone number that we can give people if they just need that one first place to start, just to make that phone call and say, hey, where do I go from here?
Absolutely. So the practice that I'm a part of is Jarrettsville Family Care. Our number is below. Additionally, if as we're reaching different people in the Baltimore County community, in our surrounding Baltimore communities, GBMC.org, we have multiple advanced primary care centers in the area. That would be a great place to start. They all have that collaborative care model that I was referring to earlier, and all have wonderful providers that are accepting new patients.
That's great. That's great. Well, is there anything else you'd like to add you think is important for our viewers to know about mental health? I mean, to me, I think the takeaway is just to know that you're not alone. And as overwhelming as that first step might be, it's critical in taking care of your mental health. So if you can make that first step, you're on your way to really getting some good help.
Most definitely. And the point and the thing I always like to mention again is we are looking forward to partnering in your care. Okay. We will meet you where you are, no matter what, and work to create a plan going forward for you that's individualized to you, that is hopefully effective for you, and will maintain that open communication together as we work toward mental and physical wellness.
Very good. All right. Judgment-free zone, right? Judgment-free.
Exactly.
Very good. Well, Christopher Toth, thank you so much for joining us. You provided such a wealth of information. Hopefully somebody out there watching who might feel like, maybe I need to take that step, maybe I don't, maybe this will help them take that first step and get that help that they need. So thank you so much for joining us.
Thank you so much, Megan.
All right. Well, once this is done, this will go on our Facebook page so you can share it. And again, we've got the phone numbers there, and gbmc.org is a great place to start as well. So thanks so much for joining us on this Facebook Live with WMAR2 News and GBMC. I hope you all have a wonderful day.